Bruising is scary for patients, and not just patients but clinicians too, because it can go along with some of the things that we're most afraid of, particularly vascular occlusion. First indication that you have a hematoma on your hands is that it bleeds quite quickly after the procedure. So needle out, often a gush of blood that comes out of the skin, or maybe it stays underneath the skin and starts to balloon. You have a hematoma at that point. Of course, the next thing we want to do is put some pressure on it to reduce the amount of bleeding going on underneath the skin. But that initial change from pink skin to bruised skin very quickly is the first sign of a hematoma. Typically, a simple vascular occlusion presents differently. It presents with pallor as your first sign. The injection has blocked the blood supply to the skin, and there may not be associated bruising. So all you get is an area of pallor that develops into this reticular pattern where you have blotchiness of pink and white tissue next to each other. That's the first sign of getting a vascular occlusion. At this very early stage, directly after the first injection, is where capillary refill is most useful. Because if you have a delay in capillary refill now that's significant without any serious bruising or only a small new bruise, then it's much more sensitive for diagnosis of a vascular occlusion. Because a delay in capillary refill in a couple of days' time or even a few hours' time, when there's already an existing hematoma next to it, is much less sensitive for diagnosing a vascular occlusion. It's part and parcel of a hematoma to get some delay in capillary refill. So how do we reduce the risk of hematoma formation? Probably the simplest thing you can do is use an instrument that causes less trauma. So where possible, if it doesn't compromise the aesthetic result, you could use a cannula. Cannulas have a blunt tip, which means they don't cut through vessels and anywhere near the frequency of a needle, which means you cause less bleeding under the skin and less bruising if you're gentle. Often people wonder, well, why don't we just use cannulas all the time? And the reason for that is there is a compromise to be made with the aesthetic result. Cannulas, because they have a blunt tip, gravitate towards soft tissue, which tends to be the fat, and they gravitate away from a connective tissue, the skin and the bone, which means you end up in the middle plane most of the time, which is fine in many areas, but not good for certain areas of the face or for certain indications for dermal filler. Your patients are often worried about bruising for two reasons. One is the aesthetic result, which is that they now have a bruise, which they didn't want. But often it's more that is this a sign of injury or a complication? So we need to help them differentiate between bruising that's associated with injury or complication or bruising that's simply part and parcel of the process. The biggest difference would be, I think, the difference between pain and tenderness. It is normal for a bruise to feel tender. If you inject someone and 2 days later they have no pain, but if they push on an area where there's a bruise, it's tender, that's normal. Whereas an increase in pain with an associated hematoma in the first 12 hours or so could be associated with a vascular occlusion. So the distinction between pain and tenderness is often a useful way of deciding what is a dangerous bruise and what is a normal bruise. The next thing to be aware of is many patients actually don't know what a bruise is. They simply think bruising equals injury, and it brings some relief to people to understand that a bruise is simply caused by the needle passing through a vessel and the vessel bleeding underneath the skin instead of out of the surface. So you have a pool of blood that's come from a vessel because a needle went through it. It may seem very surprising, but many patients don't realize that's what a bruise is until you explain it to them, and when they get that, they worry a whole lot less. Probably one of the biggest things you can do to reduce the risk of bruising is just really hone the precision of your injecting. That means stable injecting. Stable injecting starts with your feet, then your pelvis, then your upper body stabilized on the patient, and usually you end up with just your wrist being able to move with your fingers controlling the needle, and then you're injecting very carefully in a specific plane that you understand with some detail. The biggest difference in size of bruises tends to be with experience of the injector, because they tend to just have a lower resolution for where the vessels may or may not be and cause more trauma more regularly. So stable injection, high resolution anatomy, and you will notice bruising goes down. If you'd like to see more short videos like this, then don't forget to like and subscribe, hit the bell notification, and you will see more videos like it.